pray. Eternal God, we bless your holy name. We thank you that you are present among us, you God of life. We thank you for what health and what provisions for health you have blessed us with. As we meet today to consider the effects, awareness, and all that we can about the cancers that affect people, we still give you thanks and ask you to help us to not increase not only our knowledge, but our readiness to make the most of all the resources available to us to enjoy health as best we can. Bless these proceedings, those who will speak and guide us, and let it be worth the time for us to be here. Blessed be your name, Father, Son, and Holy Spirit, one God. Amen.
About 50 years ago, when people would speak about cancer and World Cancer Day, and you ask what was the importance of understanding cancer, and you would have things responded to you like, well, cancer kills. And that's why it's important to have an understanding of cancer. Well, actually, now, and Bernadine is nodding, it's because cancer does not kill and people survive that it's important for us to have more information about cancer. It's the early detection, it's the education, it's the knowledgeability of patients that allows people to survive, to detect their illnesses early, and to have early treatment. And so, yes, it is important, but it is important because we have so many survivors and there's a potential for a lot more. So this year's theme, Not Beyond Us, speaks to that. It speaks to that survivorship. It speaks to the fact that if we have early detection, if people are educated, and if we treat patients in a very aggressive and rapid way, then we will have more and more and more cancer survivors. So without further ado, I'd like to introduce Mr. Wayne Hunt for the opening remarks for the day. Thank you, Mr.
Thank you very much, Madam CMO. And even though the protocol has been established, I would like to extend a welcome to all of you who have responded to our invitation to be here at this brief symposium to mark World Cancer Day. As you know, cancer is on the list of the NCDs, which is causing death both to rich as well as poor families around the world. One of the things about cancer is that 30% of all cancers could be prevented if we bring about changes in our behavior as well as our lifestyles. The World Health Organization tells us that prevention offers the most cost-effective long-term strategy for the control of cancer. This year, solutions are not beyond us. But then, how could we use those solutions so that we could benefit ourselves? How can I lower my cancer risk? How could you lower your cancer risk? One of the things that I would like you to be aware of this morning is the whole aspect of diet. What is available to us here on Montserrat? The experts are telling us that if we consume a more plant-based diet, at least it will help us really to fight as well as to control cancers. So what do we have here? We have at the head table. These are things from Montserrat, but most of these things are bird food. For example, sourshops. How much sourshops do we use? The leaves of soursop is a very big industry where they use it really to prevent cancers around the world. And we have it readily available here. There are two things that I would like to focus in on. One is sweet, but it has bitter consequences. And one is bitter, but it's good for you. The first one that I'd like to introduce is, in Guyana we call this Corello. The Jamaicans call this Cerci. What do you call it in Montserrat? Corelli. Pomgoli. become gooey. Well, currently, this vegetable, it's actually been studied. The University of Guyana and the Lancaster University of the UK is actually studying this. Because one, it has very good cancer prevention properties in it. They're actually studying it to develop a drug to fight cancer. So then what are you going to do about it? This is something that we could include in our diets. In the Guyanese culture, there's many battles with mothers and children. When the mother cooks this, you don't want to eat it. But it's very good for you. So there's something that we could look at. The other thing is table sugar. We consume a lot of sugar. We put sugar into our teas. They added sugar in soft drinks. And when we're making drinks from fruits, we also add sugars. But look at the accumulation of the annual daily average dose. Every day you're using sugar, and you keep using it. After time, it's going to accumulate. Now, anything is a poison, even water. If you drink too much of water, you're going to die. But the difference between what is a poison and what is a remedy is basically the dosage. So then, it will do us good if we look at ways in which we could really reduce basically table sugars in our diets. Because sugar is one of the factors that predisposes for us not only to cancer, I'm talking about excessive sugars, but as well as diabetes and all the other complaints. So then, the message for World Cancer Day is very simple. Let us take steps to implement healthy lifestyle choices. We could start with exercising. We could start with eating more fruits and vegetables that is quite available here on Montserrat. So then, the solutions are not beyond us. But for us to benefit from these solutions, we're the ones who have to take active step. Thank you very much.
Thank you very much, Mr. Hunt, for that very useful piece of advice on the use of Coralie. I shall abandon my childhood days of refusing Coralie for breakfast, and I shall now consume Coralie to prevent cancer. Thank you. The next speaker this morning, Mrs. Suju Davis, has been very active in many spheres on Montserrat, but she's coming to us today to speak as a cancer advocate, and I'd like to say thank you, Suju, and please come to the podium.
I'm delighted to formally open this workshop. As with most diseases, investing in the prevention of cancer, it's cheaper than dealing with its consequences. A key part of prevention is that children and adolescents are included in policies and strategies that promote healthy behaviors. Empowering people to make healthy choices is key to achieving the global goal of reducing premature deaths from non-communicable diseases by 25% by the year of 2025. Meeting this challenge is not beyond us if we work together to empower individuals to lead healthy lives, promote an enabling environment for healthy living in our communities, and invest in health systems that support healthy lives. Stigma associated with cancer perpetuate misconceptions about the disease. This obstructs efforts to raise awareness about cancer prevention, healthy behaviors, and seeking early diagnosis for signs and symptoms. At least 1/3 of the most common cancers can be prevented through reducing alcohol consumption, healthier diets, and regular exercise. If smoking is included, the figure is about 50%. I'm sure that this workshop will be a continuation of a campaign to raise public awareness of the risk factors associated with cancer I'm sure it will encourage the adoption of healthy lifestyles as an effective prevention strategy. Thank you.
Thank you, Mrs. Davis. Mrs. Davis has really put cancer in a context for us that is relatively new, in that cancer is a non-communicable disease that has a lifestyle element to it. And lifestyle elements to diseases such as non-communicable diseases are modifiable. These are things that we can do. Being empowered, we can do those things. We can eat better, we can get more exercise, and we can invest in healthy living. We can invest in ourselves. So thank you very much for contextualizing cancer in that way for us, Suju. Thank you. The next speaker is Mrs. Bernadine Collins, who I have, and many of you have heard speak, and can be very, very passionate. And I believe she will come again this morning to give us some passionate remarks about cancer survivorship. Thank you.
Today I'm very happy to be here, and I'm glad to share it and join with Mr. Hunt in saying I believe most of those fruits you have on the table, I really grow them in my backyard. I don't use all of them, but I have a noni tree. But, you know, I use corylite at times, but I really can't use it if I have to bring it forward, you know. After that one use, that's good enough. But I do have corylite and all the other plants, because really using natural things, fresh, is very, very, very vital. But I must say today I'm very honored and privileged and blessed and happy to be able to join with the world on this World Cancer Day. This day is used to bring awareness to cancer worldwide, and more so to the Montserrat community. There are millions of persons who have died as a result of cancer, and there are millions of persons who are suffering as a result of cancer. But we are happy to say, I'm happy to say this morning that there are millions who have survived cancer, thanks to the advancement in technology that continues to advance the study and research to alleviate the suffering to many lives and families. Today brings greater awareness that solutions exist and are reachable. Today serves to abate the stigma held about this disease, and as the theme, not beyond us, it is not beyond us to meet the challenges that we face. If government should invest in provision of care, professionals support and encourage, and individuals make wise daily choices, then today we can say this is not beyond us. The focus, therefore, should be on education and encouragement in a positive and proactive way to fight cancer. And we can do this such as choosing healthy lifestyles. Healthy lifestyles choice can lower the risk for cancer. This includes, as you've heard before, avoiding tobacco, limiting and avoiding alcohol consumption, eating right, getting plenty of exercise, and of course rest, and staying away from the direct rays of the sun and other sources of ultraviolet rays. Early detection for many cancers, very, very important, because there are warning signs. And if early detection, I'm saying today that early detection is indisputable, for I am standing before you today and you're hearing my voice. And that brings me to the point I must here say that on Montserrat we have the Pink Charity Association that encourages and supports women for early detection of breast cancer. And this is so very, very important. Early detection can prolong your life, and it can save your life. And so I must here give a round of applause to the Pink Ribbon Association for the work they have been doing. Achieving treatment for all. All people have the right to access cancer treatment and services without suffering any hardship. Therefore, we should maximizing our quality of life. I'm talking about people with cancer, and not only the persons who have cancers, but their caregivers and their family members. It's very, very, very important. I am standing here, I would say, because of my faith in God, of course, and the support that my immediate family members gave me. My mother, who's now deceased, she prayed for me all the time. You know, there were times when I didn't want to say, Mama, I'm now going to have a mammogram, my mastectomy, my surgery. I wait until after the surgery to tell her because I know she's going to worry and cry. And so, you know, I want to let her know, I'm okay, Mama, so things are going okay. But trust me, her prayers was a strong tower in my life. Of course, my sister, every doctor's appointment I went, she was there. I remember one time I was going to do this bone examination, and you know how they tie your feet and put you in this thing. I said, Ali, don't come in here now. Don't come in here now. But she went to every doctor's appointment with me, of course, and she asked questions. And she supported me. If I cried at any moment, my sister would actually be crying too. And I am telling you that family support is very, very, very important. And today I could tell you my sister is my best friend. If anything happens to me, she's right there. I call her every second to talk with her because I really appreciate her encouragement and her support. But I am saying that people with cancer and their family members, they deserve high-quality, compassionate care during treatment and survivorship. This includes care for the emotional, mental, physical, and let me add, financial support that affects cancer patients. Now, all these challenges are not beyond us. If government realized that investing in prevention of cancer is cheaper than dealing with the consequences, then I believe that the government will be willing to invest. They'll spend less money. Invest in health systems that support healthy lifestyles, promote an enabling environment for healthy living in our communities. Make sure that at our work sites, we are working with less stress, that we have the necessary things that help us to work effectively without harassing and stressing ourselves. And today, I just want to say congratulations and join in wishing every one of us, and I say every one of us because you know what? All of us sitting here know somebody, a relative, a friend, a co-worker, who will be affected by this disease, cancer. However, remember, cancer is not beyond us. And today, I just want to wish us all a successful and a rewarding day. Thank you.
Next on the agenda is Miss Grethlin West. And Grethlin is going to give us an overview of a new campaign that we have. And I won't say very much more about it because she will take the lead, and it's the Show More Love campaign. Apologies, Grethlin, thank you.
I'm here today to raise awareness and educate us all about a regional public health communication campaign by the Caribbean Public Health Agency. This campaign addresses violence and injury prevention and non-communicable diseases like cancer. The theme of the campaign is More Love. Today, the Ministry of Health and Social Services is pleased to partner with the Caribbean Public Health Agency, CARFA, and a Trinidadian Rapso group called Three Canal to launch this campaign locally. Together, we are encouraging all men, women, and children to show more love for themselves, more love for life, and more love for each other. The messages are simple but powerful. And if we put them into practice, they have the potential to help our bodies to fight against non-communicable diseases like cancer and ultimately improve our health and the quality of our life. It is my pleasure to present to you a sample of these audio/video messages.
It's time to show more love for your health. Eat more fresh fruit and vegetables. Drink more water, less sugary drinks and soda. This is Tree Canal with a message from the Caribbean Public Health Agency in collaboration with the European Union, preventing disease, promoting and protecting health. It's time to show more love for moderation. Use less fat. Reduce your salt intake. Always eat in moderation. Eat smaller portions. This is Tree Canal with a message from the Caribbean Public Health Agency in collaboration with the European Union, preventing disease, promoting and protecting health.
It's time to show more love for life. Become more active. Exercise at least 30 minutes per day and cut your risk of a heart attack.
This is Tree Canal with a message from the Caribbean Public Health Agency in collaboration with the European Union, preventing disease, promoting and protecting health.
At this point of the program, I'd like to present our own advertisement with introducing Shamrock. Are you ready? Right, so let's welcome Shamrock.
How can it be treated if you don't know? It's for me, it's for you, it's for all of us. Get tested. Check your health, check your health. Check your health, check your health. Early detection, save life, take care of yourself. Go ahead, get tested. Check your health, check your health. Check your health, check your health. Early detection, save life, take care of yourself. Go ahead, get tested. Don't be uncertain of your health, get tested. We all need good health, so in that we should invest in. Be aware of the things that you eat, because many of these diseases caused by the food you digest in. Check yourself, don't wreck yourself. So, check your health, check your health. Check your health, check your health. Early detection, save life, take care of yourself. Go ahead, get tested. So check your health. I'm saying, if you're an excessive alcohol drinker or a regular smoker, you're more at risk to get oral cancer. So go ahead and check yourself. Yeah, check your health.
At this point, I would like to introduce the Honorable Dr. Ingrid Buffum, who is going to give the featured presentation on behalf of our Minister, Ryan. So let's welcome the Honorable Dr. Ingrid Buffum.
Absolutely. Check your health, get tested, look after yourself. And absolutely, we should be showing more love for ourselves and for our family members, because cancer isn't only about us. Cancer is about the people who we look after, the people who depend on us every day. So if we can look after ourselves and prevent these problems, then we'll end up with relatives who are happier in general. Good morning to Mrs. Davis. Thank you very much for championing another cause on Montserrat, and good morning to all the health workers who I know work so hard in making sure that people in Montserrat are aware and that they are able to access health services. Firstly, I'd just like to say that it's really important to make sure that we don't have fear of cancer, because if we are too afraid, then we won't want to learn, we won't listen, and if we're not listening, we won't hear the health promotion messages and try and change our behaviors and try and access the care that we need to prevent these problems. Part of the 2015 campaign for World Cancer Day by CARFA is ensuring that we consider 4 things: that we choose healthy lifestyles, that we deliver early detection, that we achieve treatment for all, and that we maximize quality of life. In terms of choosing healthy lifestyles, as everybody has said before me, it's important that we exercise. So regular exercise has been shown to decrease your cancer risk. People who exercise regularly are less likely to get some cancers, and through exercising regularly, you're more likely to respond to the treatment when you actually do, if you do develop a cancer one day. The second thing on that topic is making sure that we have a wide variety of fruits and vegetables in our diets. As Ms. Collins was saying, if it's fresh and if it's healthy, then it's really good for you. All the fruits and vegetables contain antioxidants that are actually cancer fighters, that are going to repair changes that happen even at the level of the DNA in our bodies. So by increasing fruit and veg and making sure that we have enough of these items raw and fresh in our diets every day, then we're actually reducing our cancer risk. Unfortunately, on Montserrat, there is a problem in terms of accessing these things, but I know things are going to improve here. Stay within your normal body mass index. Being overweight or obese increases your cancer risk. Therefore, through adopting a healthier diet and through exercising regularly and through monitoring what your body mass index is, if you're over where you should be and you just try to get a little bit smaller, then you're going a long way in preventing and helping yourself to fight off a cancer if one day you end up with one. Avoiding consumption of a lot of artificial foods, a lot of refined foods that do not contribute to your vitamins and minerals and your antioxidant intake. A lot of the refined starches, they're not good for us. You know, as Mr. Hunt was saying, there's nothing fantastic about sugar. It's sweet, but it's not really going to contribute to good health. If you get your sugars through natural sources, then it's a lot healthier. Reducing alcohol, avoiding tobacco also will help. In terms of early detection, in terms of access to the investigations that we need on Montserrat, I don't think we're doing too badly at all. People on Montserrat are able to access them, access some things, and a lot of things are actually affordable. For example, pap smear testing is available at all the clinics and all the private doctors. And while having a pap smear test, you can actually have a human papillomavirus test to check to see if there are changes that are happening, to see whether or not you have the virus that causes cervical cancer in the first place. And then your pap smear is going to be finding cancer early. If you find a cancer really early, then you're more likely to have successful treatment, because you can actually cure through finding it early and treating it very early. Breast exams are available at all the district clinics and the private doctors. Self-breast exams can be done by patients. Mammograms are available in Antigua, hopefully one day through maybe some sort of public-private partnership with the help of Sonia Charles. Perhaps we'll be able to have mammograms being available on Montserrat. But for now, it's just a trip to Antigua to have a mammogram done, and that's relatively accessible. Digital rectal exams in terms of screening for prostate cancer are available here as well as PSA testing is done locally at DR Diagnostics, and it's really not that expensive at all. Fecal occult blood testing is done at the Glendon Hospital if you're looking for screening for colon cancer, and last year the hospital purchased colonoscopes and upper GI endoscopes, so at some point these investigations will be done locally to ensure that people on Montserrat can have testing done to find out if they've got colon cancer or upper GI cancers. And of course, ultrasound is available for having your ovaries and your uterus assessed. So the things that we need are actually right here. In terms of achieving treatment for all, I think we need to drive home that health promotion message. If we keep reminding people that they can get tested, that the facilities are here, but it's about getting them motivated to want to change their lifestyles and to want to access the resources in the first place. In maximizing quality of life, again, through early detection, we can make sure that we find cancers early and therefore treat them properly, and people can go on having healthy lives. As you know, Ms. Collins has told us, she's a cancer survivor, and I don't know many people as strong, mighty, and powerful as she is in terms of getting her work done, looking after the elderly, and she's been able to put it behind her. She's been able to be a survivor, and a lot more people can be survivors if we, you know, get that message to them, get them out there testing themselves, get them to adopt healthy lifestyles, to eating healthily and regular exercise. So keep doing what you're doing, and thank you very much for listening.
To give us the closing remarks as well as the vote of thanks, I welcome Nurse Brown.
Please allow me to adopt the protocol that has already been established. I'd like to say first thanks to Reverend Dr. Joan Del Solmeid for giving us opening prayer and for always being here with us, supporting our programs that we have been putting forward within the Ministry of Health. Mr. Wayne Hunt, for your opening remarks and for just reminding us about how to use and to make creative meals out of all of these healthy fruits and vegetables that you have on display here. I hope that we can share them afterwards. To Mrs. Suju Davis, thank you for formally opening our day's activities today and for always being with us, supporting us, championing the cause. We're going to miss you. But I'd like to say thank you for being with us, for gracing us with your presence here today. To Grethlin for her overview, More Love campaign. We're going to be able to show a little more love. Look out for the ads on the radio. They're already being published, and they're already being sensitizing the public and getting people to love them and showing more love. So thank you, Grethlin, for being our focal point in Montserrat for the More Love campaign. The feature address by Dr. Buffon. What can I say? She's always been good at what she does. She has asked us to do certain things, decrease our smoking and alcohol consumption, decrease our sugar, salt, and our fat intake. Of course, we are going to increase our exercise and fruits and vegetables. And we are going to go ahead as Shamrock. I finally get a chance to meet you. Good morning. Get tested. Go ahead and get tested. The fight against cancer is here. We are here today as a group to show that it is not beyond us. Many of us in this room, as Bernadine said, has had a loved one or a friend who has had cancer, who has fought cancer, and of course we are all predisposed to cancer. I thank you once again as a group for joining us and showing support for our activities today on World Cancer Day. To the staff who will conduct the activities today, I'd like to say thank you in advance. To our chairperson who has stepped out of the room, please convey our gratitude to her for chairing the program thus far. I know she's busy, and so I would accept her apologies. To the media who has been supportive to us all along and has helped us to spread the message, we'd like to thank you and continue to invite you to support us in all our future endeavors. To everyone who's here, we are all champions for the cancer fight. I want to thank you all. Thank you for your support. Your presence here means a lot to us. And so I invite you to go down, get tested, go ahead and get checked. Thank you.